Dr. Mehboob, Smart Pet Clinic. The topic is urine retention in dogs and cats. Urine retention may be defined as lack of emptiness or the incomplete emptiness of the urinary bladder. Disorder of micturition may be characterized by urine retention and distended bladder, are usually caused by hypocontractility of the bladder and urethral obstruction. The prolonged distended bladder may lead to the breakdown of the tight junction between the retrosal muscle cell of the bladder, which prevents the normal depolarization and contraction of the retrosal muscle. Adrenergic antagonist may indicate when manual expression or voluntary voiding is non-productive because urethral sphincter tone is excessive, as the case in cats after the relief of obstruction. Main causes of urine retention in dogs and cats. Main causes may include benign prostatic hyperplasia, bladder outlet obstruction, pelvic organ prolapse, calculi, and constipation. Complications. Complication may include lower urinary tract infection that ascends into the urinary bladder, rupture of the urinary bladder and urethra, and permanent injury and atony to the retrosal muscle. Medication treatment. Phenoxybenzamine doses for dogs and cats is 0.25 mg per kg per ounce bid. Diazepam doses for dogs is 0.2 mg per kg per ounce tid. Doses for cats is 0.5 mg per kg IV. Bethnicol chloride doses for dogs is 5 to 25 mg per dogs per ounce tid. Doses for cats is 2.5 to 7.5 mg per cats per ounce tid. Surgery, cystotomy, urethral catheterization. Prevention, balance nutrition profile. Thank you.